The prostate is a small walnut-sized gland located below the bladder and in front of the rectum. Its main function is to produce seminal fluid, which nourishes and transports sperm. Benign prostatic hyperplasia, or enlarged prostate, is a very common issue among aging men and can seriously affect urination. As men age, the prostate naturally expands. It is situated around the urinary bladder's exit tube, so this gland plays an important role in regulating urine flow. However, as it grows in size, it can constrict this passage, leading to difficulties in urination. To address this, a doctor may prescribe medications like Flomax or certain antibiotics, and might also recommend blood tests. Regular follow-up appointments every 6 months are typically scheduled to monitor progress and adjust treatment as necessary. Now, understanding hormones is important in managing prostate health. Anabolic and catabolic processes are the two main categories that see how our bodies handle nutrients. Catabolic enzymes activate when we eat, breaking down food into its core components like amino acids, fatty acids, and glucose. Whereas anabolic hormones play an important role in utilizing these building blocks to form body tissues. In the context of an enlarged prostate, anabolic processes are involved. Prolactin is mainly associated with breastfeeding women, but it's also present in men. Elevated prolactin levels can contribute to prostate enlargement. Estrogen, a hormone known to stimulate prolactin release, further alleviates this issue by promoting prostate growth. Other influential hormones in prostate health include DHT, which is a more potent form of testosterone, in addition to androgens, cortisol, and IGF-1, which is an extension of growth hormone. Irregularities in these hormones, especially when influenced by factors like progesterone and insulin, can cause prostate size to increase. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Many men with BPH, or benign prostatic hyperplasia, experience symptoms, but it's worth noting that not everyone does. The severity and occurrence of these symptoms may vary from man to man, but the most common ones are dribbling after urination, difficulty in urinating, or complete inability to pass urine, which is also known as urinary retention. Feeling like your bladder isn't fully empty, a frequent need to urinate, especially at night, and pain or blood in the urine, which indicates the presence of an infection. Other signs are a slow or delayed start to urination, the need to strain while urinating, a sudden and intense urge to urinate, and a weak flow of urine. So if you experience any of these symptoms, do not ignore them, and consult a healthcare professional for proper evaluation and guidance. Now let's see what you should do if you want to shrink your enlarged prostate. If you're facing urination issues or an enlarged prostate, there are some really important dietary adjustments to consider. Firstly, it's important to eliminate all forms of milk and dairy products completely. Milk and dairy products often contain estrogen-like hormones and growth factors, which can promote prostate enlargement. So avoiding or reducing dairy intake can help minimize the potential hormonal impact on the prostate. Next on the list is insulin, and its main trigger, sugar. A diet high in carbs or sugars can further worsen your symptoms, so it's really important to avoid them. Instead, you should try moving to a ketogenic diet plan. It's simply a low-carb, high-fat, and protein diet, which triggers your body to rely more on stored fats for energy rather than carbs or sugars. Anyhow, another crucial factor to consider is estrogen. Men usually have this hormone in small quantities, but if your body has more estrogen and much less testosterone, it can trigger prostate enlargement. And one common reason for high estrogen levels in men is soy. If you're adding soy-based products like soy milk or soy protein isolates, especially in diet shakes, it's best not to do that, especially if you are above 50 or already have an enlarged prostate. Certain other commercially processed foods may also contain chemicals with estrogen-like effects, such as phytoestrogens, bisphenol A, dioxins, and organophosphates. So watch out for these too. Now let's have a brief look at some of the best natural remedies to shrink your enlarged prostate. Saw palmetto has a natural tendency to inhibit the production of an enzyme known as 5-alpha reductase, which converts testosterone into DHT and may cause the prostate to enlarge. Another amazing natural remedy is eating cruciferous vegetables, like kale. These vegetables are known for their high content of a compound called indole 3-carbinol. This compound has been shown to help in estrogen metabolism, which helps to regulate hormone levels in men. Other cruciferous vegetables that you can consider adding to your daily diet are broccoli, cauliflower, and Brussels sprouts. Third thing is beets. Beets provide many valuable nutrients like folate and betaine, which can contribute to overall prostate health. Both these compounds have anti-inflammatory properties, so they help reduce inflammation in your prostate or urinary tract and help to relieve your symptoms. Moreover, adopting a healthy keto diet and practicing intermittent fasting can also indirectly help to regulate your hormones and reduce inflammation that could be causing your prostate to enlarge. In addition to these natural remedies, don't forget to see your doctor regularly to track your progress and make any necessary adjustments to your treatment. This approach involves medical help, dietary changes, and lifestyle tweaks to keep your prostate and overall health in good shape. Thank you for watching and subscribing to the channel. See you in the next video.